The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to americasdemocrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight. And follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. And joining us now on americasdemocrats.org, the weekly netcast for stand-up Democrats, Dan Zuberi is Associate Professor of Social Policy at the University of Toronto and the author of a new book called Cleaning Up: How Hospital Outsourcing is Hurting Workers and Endangering Patients. Dan Zuberi, thank you so much for joining us today on americasdemocrats.org.
Thank you for having me.
You're quite welcome. I got to say, the book looks like an expose. What caused you to look into the problem of outsourcing?
When I was living in Vancouver, a newly elected right-of-center government passed legislation in 2003 that resulted in the outsourcing of hospital support work in the entire southwest region of the province. Literally 8,500 unionized hospital cleaners, dietary aides, and other support workers received pink slips overnight and found out that their jobs are now being replaced by contract workers who work for three major multinational corporations. As someone interested in low-wage work and poverty, I wanted to learn more about the consequences of this outsourcing for these workers, their families, and communities, as well as hospitals and the healthcare system. So my research team and I completed in-depth interviews with 70 hospital support workers and 26 physicians, nurses, and infection control experts, as well as taking a look behind the scenes at hospitals as workplaces and completing observation research at a few hospitals as well.
So what kinds of hospital jobs are outsourced, and why are they outsourced?
My book focuses on hospital cleaners and food service workers. Some hospital administrators have the idea that these workers are not part of the core functioning of hospitals, in that these workers, say, aren't doing surgery, for example.
Yeah.
In most cases, these jobs are contracted out with the goal explicitly to save money. In practice, it often doesn't work out that way, but I can talk more about that later. First, what happens to the jobs is that when they're outsourced to these multinational corporations, basically decent jobs that pay family-sustaining wages, in this case around $18 per hour, and had pretty good job benefits, immediately transformed into what we might call MIC jobs, jobs that pay a little bit above the minimum wage, in this case $9.50 per hour, and only provide the basic minimal benefits. Given the high cost of living in Vancouver, those workers who continued to work in these jobs suffered major hardships as they began to have to live paycheck to paycheck and struggle to make ends meet.
Well, that sounds hauntingly familiar around here, too. You know, we're speaking with Dan Zuberi, Associate Professor of Social Policy at the University of Toronto, and his new book is called Cleaning Up: How Hospital Outsourcing is Hurting Workers and Endangering Patients. We know that hospital-acquired infections are a huge problem in our health system. How does outsourcing hospital work contribute to that?
In the course of my research, I was shocked to learn about the seriousness of the challenge of hospital-acquired infections, of which many more are becoming resistant to antibiotics and more difficult to treat. It is truly a frightening scenario. In the U.S., 1.8 million people are infected every year, and an estimated 99,000 people die. Healthcare-associated infections have become the fourth leading cause of death in America. One scholar noted that more Americans die every year from healthcare-associated infections than AIDS, breast cancer, and auto accidents combined. The direct treatment costs of hospital-acquired infections have been estimated by the U.S. Centers for Disease Control to be somewhere in the neighborhood of $30 to $35 billion a year, and a recent estimate of the total annual cost of infections published in the Journal of Medical Economics puts the cost at between $96 and $147 billion per year. Infection control experts, on the other hand, estimate that between 30 and 50% of infections are preventable. So it's no wonder that the U.S. Department of Health and Human Services has made reducing hospital-acquired infections a top priority. What I argue is that the cleanliness of the hospital environment is one of the most important factors for reducing the rate of hospital-acquired infections. I argue that having a highly trained and professionalized support service staff also creates the conditions for safe work practices that minimizes the spread of pathogens throughout the hospital environment. Environmental contamination is one of many causes of hospital-acquired infections, which also include things like the inappropriate and overprescription of antibiotics, overcrowding, hand-washing, lack of hand-washing, and poor hospital design.
It's $1 billion problem. I mean, that is astounding. Well, more than $1 billion problem.
Yeah.
Wow. You examined hospitals in both Canada and the United States. For our U.S. listeners, what were your other major findings? And is the practice better or worse in the U.S. than in Canada?
This is a good question with a somewhat complicated answer. In the past few years, the U.S. has taken a few major policy steps in the right direction in terms of reducing hospital-acquired infections. I feel Canada's a little bit slower off the mark, but there is growing attention here to the issue. When it comes to hospital support jobs, most hospitals in Canada continue to use an in-house, unionized cleaning and support staff. The outsourcing trend as a short-sighted attempt to save money right now is restricted to mostly southwestern British Columbia, Alberta, and some parts of the province of Ontario. But it is spreading. It is a growing trend. In the U.S., many hospitals, whether they outsource these jobs or not, provide workers who occupy these positions very low wages and benefits, and so the problem there is pretty ubiquitous. Overall, the infection rates and threat of acquiring an infection as a patient remains far too high in both countries, with estimates ranging from between 5 to 10% of patients infected. Personally, I guess I voted with my feet, so to speak, and my sense of the quality of care overall in terms of medical treatment in the hospital is similar in both countries, perhaps with more variance in the U.S. in terms of quality. The biggest difference is that in Canada, you don't have to worry about getting a bill from the hospital for your treatment or care, and I literally mean no bill at all, except maybe for parking. So all in all, the Canadian single-payer system is much more efficient, cost-effective, and socially just, but we need to do more to address the infection challenge.
I hope everybody was listening closely when Dan mentioned you don't receive the bill. That's health care for everybody, people. Wouldn't putting an end to the use of contractors raise medical costs even more, though? I mean, especially in the United States?
This can definitely seem like a potential challenge on the surface. But when it comes to infection control, as with many other progressive policies, spending a little bit more today saves way more money in the future. Treating hospital-acquired infections is incredibly expensive, $20,000 to $25,000 per infection on average. So I think we have to ask ourselves, did it cost more for manufacturers to have to install seatbelts in cars for us to use, or to mandate that, to inspect food before it's sold? Absolutely. But we support these measures because they improve safety and they save lives. The actual costs of paying workers a family-sustaining living wage and providing decent benefits are often a lot lower than many might estimate. Research on low-wage work in retail and other sectors has found major cost savings from paying decent wages and benefits, largely because it reduces employee turnover, which saves a fortune on training expenses for training new employees. At the same time, experienced workers can often complete more tasks and work more effectively and efficiently than new hires who are still trying to figure things out. So these low-skilled jobs, especially things in cleaning, require a fair amount of skills to do well. One UK study found that just adding one additional cleaner resulted in fewer MRSA infections. But cleaners and other hospital support workers remain at the bottom of the hospital employment hierarchy. These jobs are often held by women and minorities, and so the importance of their work is often undervalued, making them easy targets for cost saving and outsourcing.
Again, we're speaking with Dan Zuberi, Associate Professor of Social Policy at the University of Toronto, author of a new book called Cleaning Up: How Hospital Outsourcing is Hurting Workers and Endangering Patients. What solutions, Dan, are there to this problem?
The good news is that pressure and action to reduce hospital-acquired infections works. The U.S. federal government, as I mentioned earlier, has done a lot to ramp up pressure on hospitals to reduce infection rates, including mandating reporting infections and refusing to pay for the treatment of these infections. Hospitals have brought in hand-washing campaigns, adopted surgery checklists, and improved antibiotic stewardship programs. When the UK mass outsourced all of their hospital support jobs in the 1990s, they also experienced skyrocketing infection rates, and massive media and public pressure in that case resulted in a series of reforms, including deep cleans of hospitals and reworking the contract tendering process so that all corporations bidding for contracts had to pay workers the prevailing wage for those working in cleaning and other support jobs. In the UK, Scotland actually went further and banned further outsourcing of these support jobs, and many hospitals in the UK have brought these jobs back in-house. Since then, infection rates have declined, and we see many examples of hospitals reducing hospital-acquired infection rates. It definitely takes a multi-pronged effort, of which improved environmental sanitation and safe work practices by all those working in the hospital are an important component. Hospitals in the medical system need to live up to their vow to do no harm, and they need to take that vow seriously. And I argue that should start with ensuring that all those who work in hospitals are given adequate training, paid living wages, and good benefits so they can take care of themselves, their families, and effectively do their jobs. Secondly, we need a renewed focus on enhancing patient safety. Interested Americans who want to do more should check out the Safe Patient Care campaign by the Consumers Union to learn more about how to get engaged and to make a difference on the patient safety front.
Okay, Dan Zuberi is Associate Professor of Social Policy at the University of Toronto and the author of the new book called Cleaning Up, How Hospital Outsourcing is Hurting Workers and Endangering Patients. Scary stuff. Dan, thank you so much for your time with us today. Look forward to having you back sometime and talking more about this.
Great. Thank you for having me.
All right, and this is AmericasDemocrats.org, the weekly netcast for stand-up Democrats. We want you to sit back and listen to this AmericasDemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to AmericasDemocrats.org and click on Donate at the top of the page.
Ralph Waldo Emerson told about a guest who came to dinner and spent the entire evening prattling about his own integrity. The louder he talked of his honor, Emerson wrote, the faster we counted our spoons. Today, America has not one but 6 guests in our national home babbling about their integrity. They are the 6 extremist Republican judges who now control our Supreme Court, and it's a bit unsettling to hear them go on and on, almost frantically pleading with us to believe in their judicial impartiality. For example, the court's newest member, Amy Coney Barrett, suddenly blurted out at a public forum in September that, quote, "This court is not comprised of a bunch of partisan hacks." Whoa, better count our spoons. In fact, each of the 6 were installed on the court by right-wing Republicans specifically because they had proven to be devout partisan hacks. Interestingly, Barrett made her unprompted and strained assertion of judicial integrity at the McConnell Center, named for Mitch McConnell, the rabidly partisan GOP senator who pulled a fast one last year, rushing Barrett onto the bench on a party line vote just before the Republicans lost control of the Senate. Indeed, old Mitch himself introduced Barrett at the forum where she gave her "We are not partisan hacks" speech. He grinned proudly at the pure hackery of his partisan protege. This is Jim Hightower saying another hardcore partisan on the court, Sam Alito, whined in October that critics accused the court's GOP majority of being, quote, "a dangerous cabal that resorts to sneaky and improper methods to get its way." Well, golly, Sam, yes, we do think that. Because again and again, you partisans sneak up on the Constitution and we the people to twist the law to fit your political bias and personal whims. If you don't want to be considered political hacks, stop being political hacks.
If you'd like more of Jim Hightower's real populism, check out the Hightower Lowdown. Jim's monthly newsletter gives you the real lowdown on which corporations, by name, are doing what to the middle class, our environment, and our democracy. Each month, the Hightower Lowdown brings you facts you didn't know, along with actions you can take to fight back. It also comes with a sense of humor. Hightower believes we can fight the gods and still have fun. Plus, get this, it's cheap. Only $15 brings you 12 issues a year. For real populism, go to hightowerlowdown.org.
This Social Security measure. I believe that we must pass legislation to provide medical care This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America. Whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. And we say hello to Steve Knievel, an advocate for public citizens' access to medicines program, focusing on expanding affordable access to medicines. Steve Knievel, thanks for joining us today on the America's Democrats podcast.
Thank you so much for having me, Jim.
Certainly our pleasure to have you with us, Steve. And, you know, Democrats recently announced a deal on drug pricing reform in the Build Back Better Act. What do we know about what may be included in the bill on this issue?
So there's three main pillars of the sorts of reforms that the Democrats are considering including in Build Back Better. So one is the long sought Medicare drug price negotiation. Number two is providing price spike protections for certain drugs, but those protections would extend beyond patients on Medicare to consumers throughout the United States. And then finally, some out-of-pocket protections. $2,000 out-of-pocket cap for Medicare beneficiaries on Part D, which would help about 1 million plus people in a given year, probably. And an out-of-pocket cap specifically for insulin of $35 per month, which policymakers are attempting to extend beyond Medicare to commercial plans as well. But to be clear, you know, that measure would just be impacting what patients pay out of pocket rather than the price that drug companies charge for insulin.
So when details of the Democrats' drug pricing agreement were released, Public Citizen issued a statement calling it a step forward, but with the caveat that Americans deserve more. And I think maybe this is where you're heading with that last answer. First of all, what makes this deal a step forward?
Yeah, so I mean, for the reasons I just mentioned, with the policies I just mentioned, you know, there are going to be millions of people throughout the country that are provided with relief from the high prices that they face at the pharmacy counter for prescription drugs. That's one and probably the most important piece. So there's going to be a lot of people that are helped, no longer facing difficult decisions between, you know, paying their rent, paying for groceries, or filling their prescription. Now, you know, we're also securing somewhat lower prices for some drugs on Medicare, but that's far more limited in the sorts of impacts that we're having on the prices that we pay overall, you know, holistically, including through our premiums, not just our out-of-pocket costs. You know, where there are certain pharma-friendly members of Congress who, you know, throughout the negotiation process over the contents of this bill, have eroded what House Democrats previously unanimously agreed on 2 years ago in the form of H.R. 3, the Lower Drug Costs Now Act. And they made changes that limit how many drugs are negotiated, have the price negotiated by the U.S. government. They limit for whom those price negotiations apply, who has access to those lower negotiated prices by the U.S. government. And they changed, you know, overall the depth of the impact of the prices of the drugs that they do negotiate. So changing, you know, how much lower are we going to secure our drug prices? How much savings are we going to realize? So those are all, and one last thing, you know, slightly outside the drug pricing space, I'd be remiss not to mention how the savings realized are used. So progressives, the Congressional Progressive Caucus, Public Citizen, many other organizations have been advocating for a large portion of the savings accrued to the federal government from drug price negotiations and other reforms from Build Back Better to be used towards Medicare coverage expansion. So providing meaningful benefits for dental, vision, and hearing, trying to lower the eligibility age for enrolling in Medicare, finally getting in place an overall out-of-pocket cap for Medicare. These are all reforms that we've been seeking, and as of now, it seems that we're only going to get, less than a half loaf, some sort of, limited hearing benefits, and maybe nothing on dental or vision.
So there's your small step forward. In what ways does this bill, though, fall short of what Americans want and deserve?
Right. So we could get more drugs negotiated. We could have people with commercial plans benefit from negotiated prices. We could seek to bring our prices more in line with those paid in other large wealthy countries versus just somewhat lower prices than the excessive prices that we pay here and now. And we could secure deeper out-of-pocket protections for beneficiaries too in Medicare and for people outside Medicare. As I referenced at the top, the $2,000 out-of-pocket cap for Medicare Part D, that people are estimating that will benefit about 1.2 or 1.3 million beneficiaries in a given year. But there's more than 40 million people enrolled in Medicare Part D. A lot of those people face high out-of-pocket costs too, even if they don't reach that 2,000 level. Those 1.2 million people or so are those who are most in need of that kind of relief on Medicare. But we need to expand that much further too, and beyond Medicare for that matter.
Yeah, and you've got given it's you got a lot more people heading that direction now as the baby boomer are still, we're still a part of this conversation, and not everyone is there yet, and so there's still more to come.
I'll tell you one I left out one extremely impactful but somewhat wonky sort of issue at play too. So Scott Peters, one of the pharma-friendly Democrats in the House, and some of his friends were successful in limiting the negotiations only to drugs that have been on the market for a certain period of time. So, previously Peters and company were advocating for no negotiations on patented drugs whatsoever, which would mean a very long time before drugs could face price negotiations. And that would be very gameable, in which, some drugs might not face negotiations at all. But this other limitation that they have in place, it's still going to be, more than a decade before or after some drugs are on the market before they are eligible for facing drug price negotiations. So there's a lot of excessive pricing that can take place over that period of time. What the negotiations will do is they'll especially help limit pricing abuses of products that have been on the market for a very long time, where companies have been successful in sort of gaming the patent system and other rules to secure their monopolies for longer and longer. Well, this will help with those sorts of products, but there are still going to be very high launch prices for all products, despite this bill going into effect, knock on wood.
Mm-hmm. And Steve, drug pricing reform has been one of the most contentious issues between moderate and progressive Democrats during the Build Back Better Act negotiations. What makes it so? You would think that we would be a little bit more in line with each other, moderates and progressives.
It is somewhat staggering, and there's a simple answer to it, and it is the power of the pharmaceutical industry. They are arguably the most powerful lobby in Washington. They employ, more than 1,000 lobbyists on this issue right now. Last number I saw, there was something like 1,600 lobbyists working on drug pricing reform and Build Back Better, and not on the right side, trying to weaken it. And that's really, frankly, it. The polling on this issue is remarkable. Like, there is vast policy consensus across the political spectrum, from your most liberal progressive Democrats to your most conservative Republicans and independents, really across the political spectrum. Polling has showed over years that there is consensus around the obvious measure of the government negotiated the prices that we pay under Medicare. So it's only when pharma throws its massive coffers at ad campaigns, at lobbying, at campaign-related activity, that we see a position where, despite this level of consensus, where there is more people that agree on drug pricing reform and Medicare drug price negotiation than the fact that the Earth rotates around the sun, quite literally. But yet our policymakers aren't fully following through with as much as they could do on that with that level of consensus. It is a demonstration of the industry's power.
All right, now, Steve, Big Pharma consistently makes the argument that drug pricing reform will come at the expense of innovation. We've been hearing this for a long time. How do you respond to that argument?
Well, you're right to point out that we've been hearing about it a long time, because it is literally what the drug industry raises anytime you try and touch 1 cent of their revenues. What they don't tell you is the massive amount of support for research and development that is funded by we, the public, American taxpayers, to the tune of more than $40 billion with a B annually through the National Institutes of Health. Most of that money goes out to universities, other sort of research centers. But the underlying funding comes from us. What they don't tell you is how much they spend, the companies themselves spend on research and development relative to how much they spend on making returns to shareholders through, just manipulations of the market through stock buybacks and dividends, which have no impact on innovation. They do more of that. The top Fortune 500 or S&P 500 rather, drug companies literally spend more on buybacks and dividends than they do on R&D. That was the case in the preceding decade. They don't tell you about how much they actually spend on research and development either. They give you sort of opaque, inflated estimates of risk-adjusted amounts that R&D costs, and they try and double count it and exaggerate how much they actually need for research and development. So, long story short, there are lots of things that we're doing to ensure that innovation will continue, and that there's quite a lot that we can do to lower prices significantly without reducing the amount of meaningful innovation that we get for new products that help people.
Going forward, it seems clear that whatever remains in the Build Back Better Act, it will not resolve the issue of drug prices. So what would your message be to lawmakers on how to keep fighting for reform?
Well, first of all, they should continue to recognize how important this is to their constituents, how popular it is for their constituents, how much their constituents are depending on them getting this done, given that politicians have been promising this for quite a long time. I would also remind them that that's the case even as drug company lobbyists are in their offices hounding them, that popular sentiment is much more important, and that they have an opportunity to help people. So, the general message would just be telling them what they already know, that they just need to be reminded that they're in a position to make an important impact on one of the issues that's most important to people across this country, and that they should do that.
Okay. Steve Knievel, advocate for Public Citizens Access to Medicines program, which focuses on expanding affordable access to medicines. Steve, we appreciate you joining us today on the America's Democrats podcast. We'd love to have you back again soon.
Would love that, Jim. Thank you again.
Thank you. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this americasdemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page.
But let's start with Western Europe. I mean, it's had its ups and downs recently, but how do you judge the state of the European Union or Western Europe today? Are these countries united? Are they strong? How do you read it?
Well, I think the Russian invasion of Ukraine has had the unexpected result of being the most unifying factor in the European Union, at least in many years. I think certainly to the dismay of Vladimir Putin, who has made no secret of his desire to create disunity and division among the Europeans, as well as between, of course, the United States and its European allies. So I think there's been an extraordinary meeting of minds among European leaders, with, to some extent, the exception a little bit of Hungary, which has been hot and cold in some of its official decisions towards, it's an ally. It's been generally an ally of Vladimir Putin, but it has also taken some, it's been up and down. But with that exception, there's been extraordinary. And of course, it was extremely important, the German decision to, first of all, cut off or suspend at least the Nord Stream pipeline to Russia.
Right.
That was totally unexpected. Germany is the most dependent on Russian oil. And that, I think, really galvanized also the other Europeans, saying if Germany can do it, we can too. Just yesterday, there was, I believe, a Financial Times piece that showed how much the Italian Prime Minister, Mario Draghi, the former head of the European Central Bank, was instrumental in getting also the United States and all the Europeans together to actually do sanctions on the Russian Central Bank, which has also been a key element in the sanctions program. So I'd say there's a lot of unity right now. It'll be tested very much in coming months because of the oil issue, the issue of dependency on oil. The Europeans, mainly Germany and Italy at this point, do not feel they can absolutely immediately do sanctions against all oil and gas imports. They're too dependent on Russian oil and gas. But for the moment, extraordinary unity, I'd say.
And what role has the United States or President Biden played in that? Obviously, a lot of awkward moments under Donald Trump. Joe Biden taking a very different approach. Has that been a positive influence?
Oh, absolutely. I mean, you said it. I mean, relations with Trump, at least among the West Europeans, was disastrous, and Biden's election was hailed as he put it, America is back. There was very, very good feeling at the last at the first the G7 meetings and certainly since the Ukraine invasion. No, it's been very good. There's, I think, for the moment, as I said, a great working together, both on NATO, EU relations, the United States, a lot of common ground there.
And if there is one outlier, and you mentioned Hungary, here the authoritarian leader and Putin ally, Viktor Orban, just reelected to a fourth term. Is he the outlier, or is there a fear that what happened in Hungary could have a ripple effect to other countries?
Well, up until, again, the invasion of Ukraine, there was a kind of Eastern Front, which was mainly Poland, Hungary, and the smaller country Slovenia to the south, but all run by very, very right-wing conservative governments. For the moment, again, there's been a tremendous reversal in Poland, which has shown itself incredibly open to welcoming Ukrainian refugees, siding with Ukraine, and basically almost breaking certainly this sort of informal sort of alliance with Hungary. Again, how long will that last? Not clear, because until the Ukraine invasion, the traditional old-time partners, the Western Europeans, were very, very worried about what was called the sort of Visegrad Pact, this East European Hungary, Poland, Slovakia to some extent, Czech Republic, and Slovenia, the right wing portions of Eastern Europe. It's weaker now because of Poland's being on totally taking Ukraine, pro-Ukraine position.
So you mentioned refugees. What has been the role? We've seen, as you mentioned, Poland for sure taking so many hundreds of thousands of refugees. How about Italy? Has Italy and other countries reached out in Western Europe to accept refugees from Ukraine?
Oh, very much so. And of course, there's been a certain amount of criticism saying, many of these countries were totally opposed to migrants when they were coming from,
of course,
from Africa or from the Middle East, non-Europeans, Africans, Middle Easterns, Southeast Asians, and now all of a sudden, all these open arms for those who look like us, quote unquote. So yes, there's been threat. Now, the case of Italy, which I know better. First of all, there were already a lot of Ukrainians here. Many of them were healthcare workers. They're caretakers for the elderly. So many Ukrainians who were fleeing the Russians, the invasion, now had family here, and they have rejoined. The numbers, of course, are much smaller than those in Poland. It's also much further away, but there are several 100,000. And now, again, will this welcoming openness will it continue for months to come when the numbers may increase by the hundreds of thousands? Again, that's probably one of Putin's strategy is create disturbance in the Europeans by creating a refugee crisis, which was also the playbook the Belarusians used a few months ago against Poland, opening up their borders and pushing all these migrants into Poland. So will this benevolent attitude toward Ukrainian refugees last many months ahead? I don't know. But for the moment, there's been a tremendous outpouring of help and assistance. I mean, everywhere I go, I see, help the Ukrainians. There are people raising food caravans going there. A lot of help, a lot of assistance, a lot of benevolent attitude towards the situation there.
Now, so I've been in Rome now for a couple of weeks, and everybody I've talked to, from taxi drivers on, have good things to say about Mario Draghi, the prime minister. That's kind of unusual for Italy, isn't it?
Well, he's an extraordinary. I mean, he's a notch ahead, atop of all their politicians. He has an excellent international reputation. He famously saved the euro during the euro crisis with his great line, the ECB, the European Central Bank, will do whatever it takes to save the euro. And he did, basically printing money. But anyways, it helped. And he has a great prestige. And so even though he was not, it's a complicated situation, how he came to power. He was not elected. He's not a politician. The parties have all been sort of bickering and fighting. And the chief of state, who basically, the Italian president, can intervene when he appointed Mario Draghi as prime minister of what could be called a broad national coalition government. It's a very odd situation. It goes from left to right with only one extreme right-wing party on the opposition. So, and they're still bickering. I mean, it's not easy. I mean, they can't all, but nobody right now wants early elections. Or at least none of the majority of the parties don't want early elections. And it would be a very difficult situation now with the situation in Ukraine. So, Draghi, and he was the person who was put in charge basically of putting into effect the large amount of money Italy was going to get from the European Union post-COVID. A lot of assistance. Italy was one of the first countries hit by the COVID crisis. The economy has suffered tremendously. It succeeded in getting pledges of large sums of money from the European Union, and Draghi will be the one in charge of basically distributing and seeing how that those big funds are employed in a country that is notorious for its corruption and organized crime. So
now,
that's to be seen what happens.
I'm pretty sure you have not been on the ground covering the war in Ukraine, correct?
No, absolutely. No, I have
but
not.
You did, of course, were there in the war in the Balkans. some 20 years ago now?
Now it's 30, I guess.
30, yeah. What difference do you see watching the coverage, particularly? Several journalists have been killed. It's been very dangerous for journalists, but it was also in the war in the Balkans, wasn't it? Tell us about your experience and how you compare it to what people are doing today.
Well, the very first big difference for journalists, certainly, is that we did not have social media at that time. And we did not even, certainly in the Bosnian War, which went from, let's say the first war started in 91 in Croatia, and then the Bosnian War went from 92 to 95. Throughout that period, there were no cell phones. So, and satellite phones were still hugely big and cumbersome, and so we're not something you could carry around. By the time the Kosovo War started in 99, we had the first sort of cell phones were working, but there was no Wi-Fi. So filing meant that you had to get to a landline, either at your hotel or in somebody's home. So you couldn't do this 24-hour coverage as easily as now, and there wasn't social media. But that doesn't. But otherwise, there are an awful lot of similarities. First of all, many journalists were killed. They were actually purposefully targeted in the Balkan Wars by all sides, but mainly by the Serbs and the Croats. There were three sides in the Balkan Wars, at least, and then there was the Kosovo War. That's another one. But and then the other thing is there was just as much disinformation and manipulation of news through the various media outlets of the warring parties, and so that was also something. Difficult fact checking was really a challenge of all the sometimes battles would be announced, slaughters here, slaughters there, and then you found out that they didn't exist, or there were ones that you didn't know about. So that was the similarity. The other similarity, of course, is at the actual war. It's ethnic cleansing. I mean, that's what we first heard about it, most of us in modern times in the Balkan Wars. And it's pretty much exactly what we see the Russians are doing.
If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the americasdemocrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate at the top of the page.